The mistakes that we see with nursing home negligence case that we end up having to talk through with clients on a regular basis are trusting too long after problems are seen. You want to be tolerant, and you want to understand that nursing home personnel have tough jobs. And you always want to be respectful in dealing with nursing home employees. But you need to firmly and politely insist on getting good care for your loved ones. If you're coming to visit your loved ones and you're seeing that they are not getting the care that they deserve and that they need, you need to talk to people, and don't just talk to the frontline employee. Ask to talk to a nursing supervisor. Ask to talk to the nurse administrator, or the administrator of the nursing home, or the director of nursing. Those are the top two officials there. Or go talk to the doctor that's assigned to your loved one. One of the problems that you run into in many nursing homes is that there are a limited number of doctors that will actually come to the nursing home, and that means that frequently the doctors at the nursing home are very closely aligned with the nursing home. But the first thing you want to do is to try to talk to the top tier administrators, meaning the administrator, the director of nursing, the doctor, or the nurse supervisor, and discuss with them the problems that you're seeing. If your loved one isn't being moved regularly, if they're not getting their meals, if they're not getting help eating their meals, if they're not being provided repositioning, if they're not being cleaned, if they're coming in and finding them soiled, those are problems that need to be addressed. If you think there have been medication errors, if they're not being taken to therapy, or not being given something as basic as water, those are red flags that you need to talk to someone and control, and you need to then start monitoring what's going on. The additional thing you need to do is only be tolerant to a point. If you find that problems are not being fixed, then you need to start thinking about moving your loved one, and that's a difficult process. If you see any red flags, the most important thing you can do is ensure that you and other loved ones visit regularly, and don't get trapped into visiting at a specific time every day. I understand people work, and you may not have the leeway to go by except at lunch or at dinner time after work. Enlist loved ones, someone from your family member's church, synagogue, or other religious affiliation. Get friends and tell them there's a problem going on, and enlist their help. Having someone that goes and visits the loved one on a regular but infrequent basis, meaning going by multiple times a week but at different times of the day. Go in the evening one day, go in the middle of the day, the later in the week. Keeps the staff on their toes, ensures that the loved one is being checked during multiple shifts. And if you are seeing problems, then you need to react to it by talking to administrative personnel.